Hi, I'm Amanda. I'm the nurse practitioner who will be working with you behind the scenes to get your child ready for their 2-week camp experience this summer at Camp Isola Bella. You'll be using a website called Camp Docs to register your child, make the payments, and take care of any medical aspects that need to be covered. For instance, every child needs a copy of a physical exam within the past 13 months. When you go into Camp Docs, you'll see a medical health record section, and that's what I'm here to talk about today. Camp Docs will ask for your permission to use some what we call over-the-counter medications. At camp, the nurse will have medications like Benadryl, Tums for an upset stomach, Advil, Tylenol for headaches, bacitracin for cuts, Aquaphor for dry skin, and nose spray for stuffy noses. There's no need for you to send any of these medications in to camp with your child. We have them all in stock. What we do ask is that you check off electronically on Camp Docs the medications that you do and do not give permission for us to give to your child. For instance, if your child cannot take ibuprofen or Advil and you do not want them to have that while at camp, simply check no. If you think it's a good idea that your child might get a headache and needs ibuprofen, check yes. We will not give a medication to your child without notification, either via VP, text, email, or a phone call. Remember, these medications are just if needed. We will not give them to your child if they are not used. Any medication prescribed by your child's doctor, such as psychotropic medications, antibiotic for a strep throat or an ear infection, special creams for skin conditions, inhalers for asthma, EpiPens for allergic reactions, even melatonin that they take to sleep. Those all require permission and paperwork signed by your child's doctor or nurse practitioner. Your doctor's office can use their own form. It's typically the same form you would use to send your child to school with a medication. Additionally, there is a link on Camp Docs, and you can use that as well. It looks something like this. The doctor will fill out your child's name, the medication, and how often the child takes it. Doctor will sign the bottom. You will scan that into the computer, into Camp Docs, and that counts as permission, and the nurse will then be able to administer that medication as ordered by the doctor. I do ask that parents not try to help and fill out this paperwork because a lot of times errors are made and the doctor signs it, and then we're stuck chasing the physician down in the summer trying to get the correct order. So again, inhalers, EpiPens, daily allergy meds, daily melatonin, daily lactose for a milk insensitivity, that all needs special permission from your child's provider. So you will see me and a number of other nurses on the first day of camp. Our job that day is to take the medications that we have permission for and that we have prescriber orders for and to match what you bring in. I have a few small favors for that. Please send medication in the original bottle. Something like this. If your child's on a liquid, we'd like the label with the medication inside the box. This is for safety reasons. At home, you might use something like this to make medications easier for you to remember. However, as licensed nurses passing the medication, we need to make sure we're giving the right medication, which means we have to look at your child, get their right name, the right dose, the right med, and the right time. Anything that comes in this, we are not legally allowed to give to your child because it's not safe. Things such as creams prescribed by your doctor should be for your child only. If your child has been borrowing your cream or a sibling's cream, we unfortunately will not be allowed to give that either. Any medication has to have your child's name on it. Now, a lot of parents like to come with vitamins, vitamin D, vitamin C, vitamin Z. It's camp. I would highly recommend you can leave those at home unless it's a special medical circumstance. For us to give a medication like vitamins, the child's being pulled from their camp activities to take something that they're probably getting in their food, at least for these 2 weeks, and they're getting plenty of vitamin D out in that sun. If you insist on bringing vitamins for your child, they will need the same doctor's order with permission from the provider. You cannot come in on the day of camp with bagfuls of vitamins. Your child will not be able to take them for those 2 weeks at camp. So we'll ask you to bring those home unless you do get permission. I look forward to seeing you on the first day of camp. The more paperwork and the more adherence we have to the medications, the faster your child's registration will be, and the sooner they'll get to jump into that water and have fun with some friends. See you in June.